Hi guys, we've been chatting recently a little bit about metatarsal stress fractures, and we've covered a lot of the reasons that might occur. We've talked quite a bit about the anatomy, and we've specifically spoken about the most common metatarsal stress fracture, the second metatarsal, and how it is basically locked in. As you can see, it's kind of pinioned between the medial and the lateral cuneiforms here, and so it is held a bit more rigidly in that joint mortise back here. We've also spoken about the issue that obviously you can see how large and thick the first metatarsal is. It's designed as a weight-bearing structure. The second through fifth metatarsals are a lot thinner, although you can also see the fifth metatarsal is substantially more robust. So apart from very specific fractures like a Jones fracture or acute midshaft fractures, we don't tend to see stress fractures in the fifth MT. So we very much see them in the second metatarsal because of those reasons, and also because it's the longest of the metatarsals. Now, one of the things that we haven't discussed at length is it's a real issue if we've got a short first MT, so a Morton's foot type, that causes an issue where the load is transferred more laterally and specifically onto the second metatarsal. Also, we've got the issue of vertical ground reaction force. So once you come into weight bearing, it will dorsiflex the first ray, and of course that will overload the second MT, especially if the first MT is short. So in terms of orthotic management, what are the sorts of things you might look at doing here? Well, I think this is one of those situations where if we look at the tissue stress model and we say, okay, well, if the foot is pronating and the first ray is being dorsiflexed, it's overloading the second metatarsal. In addition, if we've got a short first MT, we've shortened the medial lever arm, so the load goes more laterally. It makes a lot of sense to think about an orthotic device for this type of problem. So I do tend to use orthotics quite a bit with this sort of issue. You can use prefab. So obviously we talk a lot about the bioorthotic range, and for me, I love those that type of prefab because it's very nicely contoured through the arch of the foot, so it works very, very nicely in that area. Also, in terms of the reducing the load, a product like the BioSoft Plus, which is a very high impact attenuating device, offers really good contouring and very, very good shock attenuation. So from that perspective, I think it's great. Now, I would always consider with either a custom device, I tend to use carbon fiber more than any other material, or even a prefab. I'd always consider, or if I had a short first MT, I would always add a Morton's extension. I think most of you understand what that would be. For my rigid devices, I normally include it within the shell, so I actually order a device that has the Morton's extension extending right beyond the first metatarsal. So what in effect I've done is I've strengthened the medial column, I've increased the moment arm so that when you're coming into propulsion, that first MT doesn't allow you to pronate. It has excellent propulsive phase resupination properties so that we're getting a more effective gait pattern. I think also what that does is it tends to protect the second metatarsal, so we're getting more correct, even loading of the metatarsals, and that's quite beneficial. Also, obviously, the support of the arch, trying to prevent any sort of abnormal pronation, is going to, again, redistribute the load more evenly. And that's the model that we're working on now. We're not sort of talking so much about pronation being the root of all evil. We're trying to figure out what's causing the specific stress on a structure that causes it to fail, and then we're trying to reduce that load as much as we can, and that's where orthotic therapy has a very, very high impact. Okay, quick snapshot on the use of orthotic therapy for second metatarsal stress fracture. I think you can consider either a prefab, like a bioorthotic, or you can consider a custom device. With a prefab, of course, you can also add Morton's extension in more dense materials like dense EVA, but that should work very, very well, and it probably should be at the forefront of your treatment for second metatarsal stress fracture. Okay, that's all for now. I'll speak to you soon.